And he's down.
Airways, breathing, circulation, deadly bleeding. Good. Primary survey, check. Secondary survey, history. Have you ever hurt this leg before?
No.
No? Okay. What position was the body in?
I felt myself twist to the inside. My foot just didn't move. My knee twisted in.
Okay. Did you hear a snap, crackle, pop?
Yep, pop.
Okay. Observations. Obvious swelling and bruising. Palpations. Okay. Point tender on the ACL. Capsule is intact. Special tests. Active range of motion. Can you move your leg through the full range of motion for me? So flex. Can you flex it?
No.
No. Can you extend it?
No.
No? Okay. What about passively? Nope.
No.
What about
Don't
this?
do that.
Okay. What about resisted? So can you resist my movement?
Yeah, that's okay.
Okay. What about this?
I can
That's
do
good?
that. Yeah.
Okay. I suspect an ACL injury, so what I'm going to get you to do, we're going to help you off the field right now, so can you sit up for me? Good. Can you get over onto one knee? Be careful of your injured knee. Good. Good. So put your arm around that. Up, yeah.
When it comes to the etiology of an ACL injury, some possible causes are a quick change of direction when running, a sudden stop when running, an incorrect landing following a jump, direct blow to the knee, or twisting of the knee when the foot is planted, as in our case. When it comes to an ACL injury, you become more susceptible if you have increased flexibility of the hamstrings, if you're playing on an uneven playing surface, or if you're female because estrogen relaxes the soft tissue of the body. Approximately 50% of all ACL injuries occur with damage to other structures. Some of these structures are known as the articular cartilage, the lateral and medial meniscus, the joint capsule, the end of the tibia and the end of the femur, also the posterior cruciate ligament, the medial collateral ligament, the lateral collateral ligament, and something known as the athlete's triad, which is a tear of the ACL, MCL, and the medial meniscus. When it comes to the ACL injury, there are three different types of classifications. There's a grade 1, a grade 2, and a grade 3 sprain. Grade 1, which is a minor sprain, is when there's a stretch in the ACL with little to no tearing of the fibers. There is minimal loss of function, little to no swelling, and local point tenderness. The grade 2 ACL sprain, which is a moderate sprain, which means the ACL is stretched with some tearing of the fibers, there is significant structural weakening, and there is a moderate amount of swelling. A grade 3 ACL sprain is when it is completely torn, there is significant swelling and total loss of function.
Once the injury and the associated structures have been determined, the athlete will be escorted off the field depending on his or her ability to bear weight. Here we have price demonstrated, so we have protected rest with ice and compression and elevation. And right there we have a splint for when they are moving.
It's a physiotherapist's job to return the athlete to sport as soon as is possible. Rehabilitation is split into 3 stages. The first stage is post-surgery, and the entire time the athlete is wearing a splint. Stage 2 runs from when they take off the splint until there's 85% of the strength in their injured leg. And stage 3 runs continuously to prevent further injury. Okay. Stage 1 goals include pain-free, active range of motion, and return to basic function. Exercises include stationary biking, hamstring curls with very low weight, and walking in water if their incisions are healed. Stage 2 runs from around week 6 when they remove the splint. The goals of stage 2 are increased strength and endurance of the muscles. Some exercises include swimming, calf raises, and squats. Stage 3 begins once 85% of the strength is returned to the injured leg. Stage 3 is simply preventing further injury from occurring. Some exercises that you implement into your everyday routine would include proprioceptive training, strengthening of the muscles around the knee joint, and proper landing technique. Okay, Shane, it's been about 4 weeks since your surgery, so we're going to start a new exercise, and this one's just box steps. So you're going to have your injured leg towards the box. You're just going to step up onto the box and step back down. Okay, Shane, it's been about 10 weeks since your surgery, so we're going to do squats again, but this time I'm going to get you to go all the way down to 90 degrees, all right? So just remember to keep all of the pressure off of your knee and put it on your glutes. Come back up. All right, Shane, I know you think that your knee is perfectly healed, and it is, but we want to prevent any further injuries. So we're going to implement this into your regular workout routine, okay? So I'm going to get you to step up on the balance beam on your injured knee, and then you're just going to balance on one foot for a minute. If you want to make it more difficult, go up on your toes. Then, when you're done the minute, just switch, do it on your other leg.